Have you ever noticed your hand shaking slightly when you are just relaxing, maybe reading a book or watching television? These involuntary movements, known as tremors, are quite common, but understanding their nature can tell us a lot about when to pay closer attention. While occasional tremors can be normal and harmless, you should consider speaking with a doctor if you experience a tremor that occurs primarily when your limb is at rest, is persistent, and especially if it is accompanied by other changes like stiffness or slowness of movement. This is crucial because a persistent resting tremor can be an early indicator of certain neurological conditions. The key reason to pay attention to a resting tremor is its specific characteristic. It tends to lessen or disappear when you actively use the affected limb for a task, and then reappears when you relax again. This contrasts with an action tremor, which occurs during movement. A resting tremor often originates from an issue in the brain's deep structures that control movement, such as the basal ganglia, and is frequently associated with a reduction in dopamine production. Dopamine is a vital chemical messenger that helps ensure smooth, coordinated movements. When its levels are low, the brain's motor control system can become imbalanced, leading to these characteristic tremors. If you observe such a tremor, the most important step is to document what you are experiencing. Note when the tremor occurs, which limb or side of your body is affected, and if it is present all the time or only intermittently. Consider if you have noticed any other subtle changes, such as difficulty with fine motor tasks like buttoning a shirt, a decreased sense of smell, or changes in handwriting. Bring these observations to your primary care physician, who can then perform an initial assessment and refer you to a neurologist for a more specialized evaluation if needed. A particularly interesting detail about resting tremors, especially those related to Parkinson's disease, is that they often start subtly, sometimes in just one finger, and are frequently described as a pill-rolling tremor because the thumb and forefinger appear to be rubbing together. It is also common for the tremor to begin on one side of the body and remains more pronounced on that side even as it progresses. Recognizing these specific patterns can provide valuable clues for an accurate diagnosis. Ultimately, paying attention to a new or changing resting tremor and discussing it with your doctor is a proactive step toward understanding your health. Early evaluation allows for proper diagnosis and helps determine the best course of action, ensuring you receive timely and appropriate support if there is an underlying condition. Remember, observing these signs calmly and communicating them clearly is empowering for your well-being.